India Foundation, which was established in 2020, is a pan India registered non-profit dedicated to making mental health care accessible to all over India, with a team of over 100 students, including trained professionals and volunteers. So it has been working since 2020. Individuals to assist around 1,700 cases through free and paid services as well. Our initiative also includes students' education programs and internships to train future psychologists. We are honored to have Divya Ghai Chopra ma'am, who is a consultant psychiatrist with over 8 years of experience in neuropsychiatry. She is specialized in sleep disorders, um prenatal psychiatry, and child psychiatry. And she's currently working with, she has her clinic named Mind Heal and Mind Heal Plus Clinics, which is located in Dehradun, Uttarakhand. So, ma'am, let's warmly welcome her. First question is like in India, many parents hesitate to start psychiatric medications for their children. Like they fear of lifelong dependency on them. So, according to you, according to your perspective, how do you explain the need for such treatment and how do you address this issue?
So that's a very common question asked by the parents and even adults also. And it's a very major thing that we have to encounter and we have to address it very oftenly. So what we do is, yeah, I do is we tell patients about first about the how this disease occurred, how what is the logic behind the diseases, and what is the logic behind the medicines. See, every illness, every mental health illness has a different course. It can be episodic, means it comes in episode and then go away. Or it can be chronic, that it is going to stay for lifelong. So every disease has a different time period of treatment. For episodic illnesses, we give treatment for a particular duration of time. But for chronic illnesses, the treatment has to be taken for lifelong also. So,
Yeah.
so we need to explain about the disease first, then the treatment.
Yeah, okay, ma'am. Like researchers often advise cautions with psychiatric medications during the pregnancy. So, like, how do you approach treatment in cases where pregnant woman is surely, like, she severely needs the medications, but she's pregnant and she cannot safely go without the medications for that time period?
Yes, pregnancy is a very crucial period in a woman's life. So a lot of changes happen in a woman's body during pregnancy, hormonal changes, physical changes, even psychological changes. So
Yeah.
first of all, we have to understand that there is a, even if the patient is not on any medication, she is perfectly normal mentally and physically. Still, there are some risks to the child that there can be some mishappenings that can occur during pregnancy to the mother or to the child. If the mother is having a mental health illness, then the chances of having its adverse effects on the child it increases. Like it can lead to low birth weight, it can lead to premature delivery, or it can even lead to some malformations in the baby. And with medications, there are now various developments have been done. There are various researches have been done. So there are some medications that are safe during the pregnancy and they don't increase the risk of any adverse effect during pregnancy or after the delivery. So there are medications that are safe during pregnancy also and even after delivery when the mother is lactating. So we need to explain them first about the general population, those who are not having medication and those who are having medication. The risk of adverse events during pregnancy it increases more when the mother is having a mental illness rather than if
Sure.
she is on any treatment.
Yeah, ma'am. And ma'am, can we say that somewhere or the other lifestyle or therapy help it a lot for a
Yes,
mother to be?
yeah. Definitely lifestyle, family support, and therapy, they are helpful, but that also depends on the severity of the condition. Like you said, if the mother is severely depressed, then therapy is not going to work. Then she has to take the medicine. But in mild cases, therapy and only lifestyle modifications, they can also help.
Yes, ma'am. But ma'am, for example, like she is severely depressed, so medications plus therapy, would that work?
Yes, yes, it will work. But
It will
first,
work.
we need to give her medication to make her a little bit stable so that she's able to understand what she's being told during the therapy sessions.
Yeah, ma'am. But ma'am, still in India, like there are various ample number of women who are not even, exposed to medications, and they are
Yeah.
just, yeah, they are just
Mm.
living that way only. So that is a
Yes,
sad part of India.
yes, yes, yes.
And
Yes.
ma'am, as pregnancy, it can lead to like various number of disorders, including ADHD. Like it is a childbirth disorder. So like ADHD is being talked a lot these days, and you can see it in social media. For example, like Alia Bhatt, pastly she has been talking that I have been diagnosed with ADHD. Like she has self-diagnosed it. So like in your views, does this reflect genuine awareness in like in the world, like it has been overdiagnosed or something that is underdiagnosed, or like people are not genuinely aware of what ADHD is?
First of all, ADHD, it's a neurodevelopmental disorder, and not every pregnancy is going to lead to ADHD. If there
Yes,
there
ma'am.
are some risk factors which can increase the risk of ADHD, like infections, or the mother is having some other physical illness, or she has been exposed to radiations, they increase the risk of ADHD. But ADHD in all can happen to anybody. It's basically about how your neurons are developing, how they are connecting with each other. Now,
Yeah, ma'am.
coming to social media has both its pros and cons, but from awareness point of view, it is very good that people are being aware about the diseases, about the mental health problems. But we always advise, don't self-diagnose. If you have any confusion, then seek clarity from a professional. Even
Yeah,
if you self-diagnose yourself, you are directly going to the doctor and saying, I have this, kindly give me the treatment. But
yeah,
that is not it how it works. You need to be assessed first by a professional, then only he or she can advise you what you need actually, or even if you have any illness or not. Some normal people also come that I am having trouble in concentrating, so I think I have ADHD.
yeah,
So
ma'am. Just
every
ma'am, few
hmm,
symptoms of ADHD like inattention or hyperactivity. So if a person in general gets hyperactive, मतलब किसी चीज को लेके वो थोड़ा सा भी hyperactive हो जाता है कि oh I have to do this, oh I have to do that, तो वो भी मतलब उसको due to lack of knowledge, मैं ये बोलूंगी कि वो उसको ADHD diagnose कर रहे हैं. That
hmm,
could be like they have lack of knowledge, they are
hmm,
not exposed to what actual the disease is, and
hmm.
casual behavior भी एक तरह से हम बोल सकते हैं according to me.
Because they pick only one point and they apply it on themselves.
Yeah, they
They
don't
know
go
the whole
deeper into
picture.
the. Yeah,
Hmm.
yeah, for sure,
Yes,
ma'am.
yes.
Yeah, so my next question would be like, how do you manage confidentiality when treating minors, especially when parents want to, know everything about the child, but somewhere or the other child seeks privacy.
Hmm.
So how do you address these issues and how do you manage things?
So privacy and confidentiality, it is a very important part of mental health. So if the child is minors, less than 18 years of age, if there are some things that there are thoughts of self-harm or suicidal thoughts are there, then or there are thoughts of harming other people, then we surely need to tell the parents. But
Yeah,
other things, we can keep them confidential so that therapeutic alliance can be maintained and the child should trust their therapist with anything. But if you find that there is a risk of self-harm or harming others, or the person is going to get violent in the coming time, or right now or she is having those features, then definitely parents should be informed about that.
yes, ma'am, for sure. So, ma'am, would you like to share any case with us, like as we are?
So I had a girl. Exactly, she is not minor. मतलब, she's about to be getting 18. So
Okay.
she had suicidal ideations. She had depressive features. But parents, they did not even come to know about it. And just because she had a panic attack, then they brought her to me. So when I talked to the patient, then she disclosed that she, for the past 6 months, she's having suicidal thoughts and she has even tried to do it. But parents had no knowledge. So in that case, we had to inform the patient's parents because she needs to be supervised. Otherwise, she can take any step.
Yeah.
So parents need to be informed in these kind of situations.
Yeah, ma'am, for sure. So, our next question would be like, how do you approach situation where parents' behavior themselves are not contributing to the child's mental health symptoms? Like, they're not, parents are not aware of their behavior, like how they are actually behaving, and somewhere or the other, it is leading to the symptoms or making it more severe for the child.
Hmm. It is a very difficult situation because parents then say that doctor is not good. They are blaming us for our child's problem. First of all, they don't accept that the child is having any problem.
Yeah,
So for that, you need to take few sessions. You can't directly disclose it to the parents that it's because of their parenting style that the child is having these kind of problems. You first need to have a harmony with the patient and with the family members, especially parents. And after few sessions, when the trust has developed, then only you can step by step tell the parents that what the child has undergone during they underwent their in their childhood. It could be childhood neglect, abuse, or even overprotection can also lead to childhood mental health problems. So we need to address it very carefully and step by step. So you don't need to hurry in that situation, but because it will break the trust between the doctor and the patient.
yeah, for sure, ma'am. And ma'am, do you think that generational gap would also play a role in this?
Generational gap has always been there. So parents and children, they are having generational gap. So and adolescence, it's that period where having a difference of opinion with parents is quite normal. But
Yeah,
it should not become the kind of ODD or conduct disorder thing. And some kind of differences, they are normal and they have to be there because the child is developing autonomy at that time. So they
yeah,
need to become independent. So parents also need to be psychoeducated about that some decisions they should allow their children to take by themselves, and they can't interfere in everything. That is how the child is going to learn. So generational gap definitely is there. Like we have seen on social media also the generational trauma that
yeah.
it keeps on passing to the other generations. So it needs to be broken down. So that is why awareness about mental health issues is important, especially in children.
Yeah, and
And
ma'am, at last, understanding your child is that all matters. So
yes, yes.
you have to be supportive towards the child. Yeah,
Because normally what parents do is they kind of keep the authoritative figure in their family, so they don't actually listen to their children and they just negate it and disqualify that whatever you are saying is not right and it doesn't
not right.
happen.
Yeah,
That is only because there is no awareness about these issues.
yeah. And ma'am, even awareness है भी तो somewhere or the other वो denial phase में है कि like if we talk about rural areas in India, so they are like if we call कि आपके बच्चे को ये है तो उनको ये लगता है कि ओ ये हमारे बच्चे को ऐसे कैसे बोल रहे हैं. तो
Hmm.
it can be a sign of over protectiveness कि वो इतने
Hmm.
ज्यादा प्रोटेक्टिव है अपने बच्चे को लेके कि वो
Hmm.
उनके against they are not ready to listen anything.
Yes, that is why a balance has to be maintained, and parents have to understand that it is not against their child, it is for their children that
Yeah,
the doctor is saying this.
yes ma'am, for sure, that is reality.
Hmm.
Okay, so like what patterns do you notice in patient who have developed dependency on sleeping pills? So, like as you are a sleep disorder specialist, so like how do you notice these dependency, and do you like how do you help them withdraw safely without worsening their problem?
See, to label someone having a dependence on anything, whether it's a drug or a behavior, it needs to qualify some criterias. So, number one is a strong desire should be there to consume that substance or that medicine. Second is that with time, the patient has tolerated the lesser amount of that substance, and subsequently they have increased the amount over a period of time.
Yeah,
And third is obviously the withdrawal symptoms, that
yeah,
when it is not available with them, then they suffer from withdrawal symptoms. And the other most important thing is that they remain preoccupied about that substance or that drug or that behavior. So it causes impairment in their daily functioning, in their work, in their family life, in their relationships, in their occupation. So these are the criterias that need to be fulfilled to to label someone to be dependent on something. And when we try to treat the dependence on sleeping pills, we usually taper first of all, we need to find out what is the reason behind the dependence. Like,
yeah,
why did the patient start taking these pills? So first of all, we need to address that issue also. And the second thing is we taper down the amount of substance or the pills they are taking slowly, and so that the patient feels comfortable, and along with that, he doesn't have any kind of insomnia problem. Or we replace those medicines with other medicines so they don't get dependent on them also.
yeah. And ma'am, what all disorders could lead to this particular thing like dependency?
What disorders means?
Ma'am, like if a particular person is having sleeping problem, so like there any other disorders like anxiety, depression that could lead to this particular behavior that he's getting dependent, like substance abuse, addictions,
Dependence is altogether a separate
addiction.
disorder.
Yeah,
Okay. Substance use disorder. So the substance, it can include anything. It can be pills, it can be opioids, cannabis, alcohol, or it can be behavior addiction like with the phone or with the internet, with the games. So
yeah,
substance use disorder is a separate
different.
disorder.
Yeah.
And in anxiety, depression, there are some medicines that can lead to dependence, like benzodiazepines are there. So
Mm.
we usually give them for a small period of time so that they don't develop the dependence.
Okay. So, ma'am, like how do you measure if like what are your three biggest misconceptions about psychiatry? Like you have been in this field over 8 years, so like what misconceptions do you feel in India that India is holding today, and how do you wish that what all things you wish you could change in India, or uh, or anywhere in the place like you anything?
सबसे बड़ा तो अब पता नहीं इसको मिसकंसेप्शन करेंगे कि क्या करेंगे. They don't believe that psychiatric illnesses exist.
Yeah.
कि होती ही नहीं है. It's all in your mind. अगर आप अपने माइंड को
Hmm.
खुश रखोगे तो सब ठीक हो जाएगा.
Hmm.
सबसे बड़ा तो यही है. इसको आप डिनायल कह सकते हैं या इसको आप लैक ऑफ अवेयरनेस कह सकते हैं, that it is not there and they don't even believe in mental illnesses.
Yeah, yeah,
Second, that you asked a question about that the medicines, they don't think that medicines are safe. They think that medicines are not safe. And second is that you will get dependent on these medicines. So
yeah,
that is a very common myth that is there. And the third one is that you will be labeled as a mad person if someone finds out that you are having a mental illness. So they don't categorize it as a medical condition. They just think that it's some kind of habit that
yeah.
can be changed on its
The
own.
the particular labeling is there.
Yes, yes, yes.
Yes.
And the things I would like to get changed is that people get more and more aware about these problems, and that the stigma should be removed around these conditions. And those who are having mental illnesses, they should be given equal opportunities as the other people, and they
Yeah,
should be
ma'am.
treated just like any other physical illness,
For
because
sure.
they have scientific reasons behind them.
Ma'am, I would like to share experience of mine. Like, you're from Dehradun and I'm from Dehradun as well. So, like in Uttarakhand, like there is a particular tradition called Jagar and Jagri. Like
Hmm.
of that is a very cultural based.
Hmm.
You can be that can be seen in like inner places of Uttarakhand, like Pauri, Garhwal, Chamoli, and everything.
Hmm.
So once I was doing an internship in mental health hospital, Selakui.
Hmm.
So one patient came. I would not disclose the name and identity. She was having bipolar disorder. So
Hmm.
she, she was having schizophrenia. She used to
Hmm.
hallucinate a lady. So when we
Hmm.
asked कि आप लोग मतलब आपको कुछ दिखता है, तो she said कि मुझे देवी माँ दिखती है. Like
Hmm.
particularly उन्होंने उसको वहाँ पे वो कर दिया कि मुझे देवी माँ दिखती है. अगर दिखती भी है तो she is coming because she wants me to be blessed. She is giving me her blessings. So
Hmm.
like इस तरह के misconceptions भी है लोगों के दिमाग में. तो ये करके भी वो मतलब दे आर नॉट गोइंग टूवर्ड्स दी मेडिकेशंस और हेल्प. मतलब वो एक्सेप्टेंस ही नहीं है कि उनको हेल्प चाहिए.
यूजुअली डॉक्टर के पास आने से पहले वो सब जगह होके आते हैं, तंत्र
हम्म.
मंत्र एंड ऑल दैट करवा
या
के, फिर जब कुछ नहीं इफेक्ट आता है देन दे विजिट द डॉक्टर.
या फॉर श्योर दैट हैज बीन very
It's a very
much in
common thing,
Uttarakhand. A
and
very
I
common
believe
thing.
in all the places it is there. So
Yeah,
the difference will be in the kind of ritual they are doing, but it is there at every place.
yeah, for sure, ma'am. And ma'am, as you have given your background as neuropsychiatry, so like how do you see advancements in EEG or neuroimaging, including the that has been including in psychiatry? So like how do you see those things which help them in diagnosing or anything related to treatment? Like are they really helping people, or there has to be something included other than that?
So, you all must be knowing वैसे तो that EEG and neuroimaging, they don't have any significant role in diagnosing mental health illnesses. Mental health illnesses are diagnosed solely based on your clinical history and mental status examination. And
Yeah,
along with that, you can perform psychological tests that can help you in clarifying about the diagnosis of particular illness. But as such, if you say that I get a neuroimaging CT scan, MRI, and it will show that I have depression or I have bipolar disorder, it is not going to be there. A lot of patients come that मैम CT scan करवा लें, उसमें पता चल जाएगा, या ब्लड टेस्ट करा लेते हैं उसमें पता चल जाएगा. So it is also a misconception, and no kind of blood test, EEG or neuroimaging help in diagnosing the mental health problems.
yes,
EEG,
ma'am.
it helps for the diagnosis of seizures, and if you want to have a clarity whether the patient is having a seizure or a pseudo seizure. And neuroimaging, that also helps if you are having a doubt that the person might be having some structural problem in the brain. Because structural illnesses, they can also lead to personality changes or mental health problems. They have a role in that case only. And for research purposes, it is there. There have been many advancements done. Functional MRI is there. PET scans have been done. So they help the researchers in finding out that what regions are involved, what kind of impairments are happening in the brain that can be causing these problems.
Yeah, for sure. That is the thing. And ma'am, what has been the most unexpected learning from, conducting the mental health or drug awareness in your areas? Like,
Uh, Again, I think it will be a repetition that people are not aware about these kind of
Yeah.
issues. They don't even know that if you are sad for, and along with other symptoms, if you are sad for more than 14 days, then it's called depression. They just think that ये तो ऐसे ही कर रहा है, ये तो इसका स्वभाव है, ये तो इसका ये है.
Hmm.
तो सबसे पहले तो वही कि लोग अवेयर ही नहीं है, एंड दे कीप ब्लेमिंग अदर थिंग्स फॉर दीज काइंड ऑफ प्रॉब्लम्स. कि इसको डांट दिया था तो ऐसे हो गया, इसको कुछ बोल दिया था तो ऐसे हो गया. एंड दे डोंट वांट टू एक्सेप्ट दैट दीज आर द इलनेसेस दैट आर एक्चुअली देयर, एंड दे डोंट
Lack of
थिंक दैट.
knowledge.
हाँ. एंड वही कि दे डोंट actually know that these have scientific reasons and scientific causes behind them.
Yeah. That has been, मतलब this could be included in misconceptions too. कि
Yeah, yeah.
मतलब वही चीजें हैं इंडिया में कि लोग एक्सेप्टेंस नहीं है लोगों में,
Hmm.
लैक ऑफ
Hmm.
नॉलेज है, एंड दोज हु आर विलिंग टू गेट द मेडिकेशंस और हेल्प, तो दे आर
Hmm.
नॉट एक्सपोज टू द एरियाज, और या
Yeah.
उतने फाइनेंशियल रिसोर्सेज नहीं है या कुछ भी.
Especially in Uttarakhand, accessibility is a problem,
या
and related to medicines, affordability is also an issue.
Yeah, ma'am. Like it is only one hospital that is in Dehradun, and
Hmm.
so many places they don't have mental health hospitals.
Hmm.
We can
Yes.
say that thing. Yeah.
Yes.
And
Yes.
not
Yes.
only in Dehradun, ma'am, I think कि पैन इंडिया बहुत सी जगह ऐसे हैं जहाँ पे
Hmm.
नॉट ओनली मेंटल हेल्थ हॉस्पिटल्स, वहाँ पे नॉर्मल हॉस्पिटल्स भी नहीं होंगे, एंड इफ द गवर्नमेंट हैज मेड, तो उसमें भी मतलब इतने ना डॉक्टर्स हैं ना कुछ हैं, तो दिस इज द
Even
वर्किंग.
infrastructure is not there,
या
so
या
how can a doctor work there?
Yeah. So, ma'am, like, how do you measure if they actually change attitudes, not just by providing the informations? Like, have you seen any such cases कि जब आपने अवेयरनेस ड्राइव्स ली हैं या कुछ भी करा है, तो मैं लॉन्ग रन के लिए उनके अंदर कोई चेंजेस दिखे हैं आपको?
Uh, like I have done awareness camps in schools and colleges, and especially the students, they have started accepting that yes, these are the illnesses. It's very difficult for their parents to convince, but I think the youth is now more aware about these kind of issues, and they are accepting that just like any other physical illness, mental health is illnesses are also there, and they need to be treated properly, uh, just like any physical illness. So
Yes, ma'am.
basically, the attitude is determined in a longitudinal basis. It depends on, you have to ask repeatedly the people what they are doing about their mental health. Only then we
Yeah.
can know that if there is an attitude change or not.
Yes, ma'am. And ma'am, as you mentioned earlier कि पेरेंट्स के बिहेवियर भी बहुत इन्फ्लुएंस करते हैं बच्चों में. So like, have you been conducting such awareness for parents as well?
I have not yet done that. I
Okay,
have
so like,
basically told about the mental health problems to children
okay, so
and the
like, are you
students.
planning, like, because it is an, real issue कि
Yes,
जहाँ
yes.
जब सपोर्ट सिस्टम खराब हो तो फिर वो
Hmm.
चीज
Hmm.
मैटर ही नहीं करती.
No, surely we can do that, because sometimes the parents are having mental health issues that are causing the mental health problems in the children. But
Yeah.
parents, they don't accept it that they are also having the problem.
Yeah. And here genetics also play a major role.
Yes, yes, yes. So to improve child's condition, the her or his environment also needs to be changed and corrected. For that,
Yeah.
the parents have to come forward.
Yes, ma'am. So, ma'am, would you like to share any case like who have, like which has been a learning experience for you as well? A very insightful case जिससे कि मतलब आपने सीखा, आपको मतलब बहुत insightful feel होता है उस चीज को लेके.
Okay. So basically, I love psychopharmacology, like trying medicines in the patients. So a young girl is there, approximately 19 years old. So she has borderline personality disorder. And borderline personality disorder, it has other issues also like anxiety, depression, suicidal thoughts. So she
Yeah.
had been consulting some other psychiatrists and psychologists from the last 2 to 3 years. So she didn't get any improvement from there. Then when she came to me after taking full history and all, so I prescribed her a latest recent medicine that has become available. So, and she showed a drastic change in her behavior and in her thought pattern. So that was a very good positive thing for me.
ओके मैम, लाइक उस मेडिसिन को मतलब आपने एक तरह से टेस्ट करा उस पे.
Yeah, yeah.
या सो दैट
So
इज वेरी
in
नाइस.
the last 5, 6 years, she was suffering, and within 10 days, she got improvement.
Yeah, so that is a very effective thing for you
Yes,
as well.
yes.
Yes, ma'am, very nice.
I want to ask some questions that many that you have talked about the post trauma after the pregnancy. So I have the question: many women experience emotional distress or even through came up with the trauma after childbirth. So from your experience, how can psychiatrists and psychologists can work together to support a woman to healing from post birth trauma from like both through medical treatment and psychological
What
intervention,
kind of trauma you were talking about?
like depression or something she feel like कि, uh, maybe there is some kind of a problem in between me that I am not having the bond with my
Hmm.
child. Like sometimes after the delivery na, she feels like more care should be from my for me also, but
Hmm.
there are from Indian parents who don't look mostly,
Hmm.
they always go for the child first then
Yes,
come up
yes.
with the a girl, and sometimes they even don't think that the woman have some complications in that, and
Hmm.
after the pregnancy she can't walk or she needs some kind of a extra care.
Hmm.
So she sometimes became like lonely and much not care she gets.
Hmm.
So how I'm not talking about in these
Hmm.
terms.
So, first of all, the most important role is of the family in this kind of situation, that they need to support mother in for her physical health also and for her mental health also. Because it has been seen that approximately 15 to 20% of females, they develop anxiety and depression during pregnancy and after the delivery also. Now, after delivery, there are two kinds of conditions. One is postpartum blues, and the other is postpartum depression or postpartum psychotic disorder. So, postpartum blues, they usually start after 3 days of delivery, and it is a self-resolving condition that goes away after 10 days of the delivery. So, in this, what happens is the all the symptoms that you have mentioned, that the mother feels lonely, she worries a lot, and she might be having some sleep issues also, and she can have anxiety about herself or about the child or the other family members, but these are at a very mild level. And if lifestyle modifications and the support is given to the mother, then it becomes easy for her to go through this. But if the mother is having postpartum depression is what I have told you in postpartum blues, it gets double or triple in intensity. And it usually starts within 2 weeks after the delivery, and then it stays for a long period of time. In that period, the mother is actually in depression. She has real sadness. There might she might be having suicidal thoughts, or even she might be having homicidal thoughts, like even to kill her child. So that is a severe condition, And depending on the severity, psychologists and psychiatrists then they come in the role. So therapy and both medication, they are going to help the mother. If the condition is mild, then only therapy can help. But if it is in moderate to severe intensity, then along with therapy, she needs to take medicines also.
Okay, so in this we can say कि जो मदर है वो एक्स्ट्रा केयर करती है टुवर्ड्स द चाइल्ड, या फिर जो मदर है वो बिल्कुल ही चाइल्ड को छोड़ देती है या फिर थोड़ा जेलस टाइप ऑफ दिखाने लग जाती है.
Mhm.
सो मतलब दोनों केसेस होते हैं या फिर इट बिकम्स पर्सन टू पर्सन.
It varies from some people can have obsessive thoughts, like worrying about the child too much. That creates anxiety. But if it is depression, then she can have infanticidal thoughts also. And if it is gone to the level that she has developed psychosis, then the other symptoms also come, like suspiciousness and hearing of voices. That becomes a separate disorder.
सो बेसिकली कि जो इंडियन फैमिलीज होती है, सो बेसिकली दे यूजुअली नॉट ज्यादा ध्यान नहीं देते इस चीज पे. तो यू कैन
Mm.
सिंप्लीफाई सम काइंड ऑफ सिम्टम्स कि जो इंडियन पेरेंट्स को या फिर जो न्यूली अब जेंजी वाला जो अब आगे आ रहा है, सो दे आर लाइक मोर अबाउट द क्रेजीनेस ऑफ द प्रेगनेंसी, तो उनको कुछ ऐसे सिम्टम्स जो देखने को मिल सकते हैं बाद में, एंड दैट यूजुअली दे डोंट नो कि वो सिम्टम्स क्या है, कैसे है, क्या होता है. तो यू कैन पुट सम काइंड ऑफ अ सिम्टम्स कि ये सिम्टम्स मे बी हो सकते हैं, दैट they have need some
Mm.
go with some kind of a psychologist to get the support. So
Mm.
could you please tell some
There
kind.
are some red flag signs, like if sadness is there, which is persisting for more than 14 days, if there is no interest in any activity or daily activity or any pleasurable activity, if there is irritability that is out of control and it is without any reason, and the most important is the suicidal thoughts and the infanticidal thoughts.
ओके, सो द पॉइंट इज कि जो इंडियन में वुमेन्स होती है, तो यूजुअली दे डोंट कम अप विद दैट, या फिर अगर वो आना भी चाहे तो उनके जो मम्मा पापा पापा होता है तो मे बी वो भी बोल देते हैं कि ये सबके साथ होता है यूजुअली दैट. तो इफ
Mm.
अ मतलब प्रेगनेंसी वुमेन कैन केम विद यू कि मेरे को ऐसे ऐसे डिस्ट्रैक्शन फील हो रहा है, डिस्कनेक्टेड फील हो रहा है फ्रॉम द चाइल्ड. सो आपका उसमें क्या
Mm.
मेजर रोल रहता है सबसे पहले उनको बताने का, कि ताकि वो एक डिस्कनेक्टेड फील ना करे चाइल्ड से.
सी जो इमोशनल बॉन्डिंग होती है चाइल्ड के साथ, इट डेवलप्स विद टाइम. इट इज नॉट अ सडन एंड इट वेरीज फ्रॉम पर्सन टू पर्सन. कुछ लोग एकदम से कनेक्टेड फील करते हैं एंड कुछ लोगों को बहुत टाइम लग भी जाता है. सो वी टेल देम दैट इट्स क्वाइट नॉर्मल एंड दे शुड टेक देयर टाइम, because it's a very new thing for all the family members, especially for the mother, because she has undergone major changes in her body also and in her life also. So in that case, we need to have a clear picture, a full history should be there. So it is only disconnection or it is associated with something else also. So if it is only an emotional kind of thing, disconnection only, then we can psychoeducate that person. But if it is more than that, then we need to treat that.
Okay, so thank you so much, ma'am. That's my from side. Anyone has to ask anything? Yeah, go ahead.
Hello, ma'am. It was
Hello,
lovely listening to all your answers. They were very insightful.
thank
Um,
you.
you're welcome. Now, my question is there any link between stress and anxiety? And could you differentiate high functioning anxiety and chronic stress?
Stress, anxiety, they are now very common terms that are used, and there is a very small, I can say, a fine line between them. Stress and anxiety, they both are normal. Okay. So what is stress? What is the definition of stress? Stress is that whenever something is happening in your life, you develop a psychological and a physical response in your body. Now, this stress, you must be knowing, it can be eustress or it can be distress. Means it can be positive or it can be negative. But and then comes the anxiety. Anxiety is basically, it is fear of unknown. Like you have apprehension about something, you are anticipating something, and then you are having a anxiety situation. So stress has a cause. Like it can be because of work, it can be because of relationship problem, it can be because of financial problem. But anxiety, it is usually because of an unknown thing. And anxiety, it becomes a disorder if it starts causing impairment in your functioning. Okay, so anxiety is also normal, and there is a very fine line of difference between stress and anxiety. High functioning anxiety, on the other hand, is that the person is having anxiety, they are feeling anxiety, it has gone to anxiety disorder level, but they are able to maintain their functioning with that. Like they are able to perform in their work or in their family, but when they are alone or inside, they are feeling too much of anxiety that they are able to mask it. There is just this kind of difference in high functioning anxiety and normal anxiety. And chronic stress, if like I said, if stress becomes chronic, it is persistent from a very long period of time, then slowly and slowly it changes your adaptation system, and you remain alert all the time, and it then creates anxiety. And anxiety, if it gets heightened, it can lead to anxiety disorder. So it all depends on if there is an impairment in your functioning or not. Because everything is normal till the time it is causing trouble in your life.
Right. That's so insightful. So, ma'am, what would you suggest someone who faces anxiety but not to the level of a disorder? Like, what are some tips that you will give to prevent that anxiety turning into a disorder?
Hmm. So there are five, six basic things that a person needs to do. So number one is that they need to take care of their sleep. They have to take a good quality and appropriate duration of sleep at night. Second thing is to keep themselves active physically, like they can do walk or they can do physical exercises. Third is that they can perform or they can do some kind of meditations or normal breathing exercises that usually helps in calming down our autonomic nervous system. So that way anxiety it relieves. So this is for the symptomatic treatment, like you are having physical problems, this is for that. But for the psychological issues, you need to learn journal writing. You have to challenge your thoughts, whatever kind of negative thoughts are coming in your mind. You have to change that thought pattern. Only then you will be able to address those thoughts and you can normalize them.
Right. That's so insightful. Thank you so much. I have one more question. So, since you are a sleep expert and we Gen Z need to know more about it, I want to ask you, like, what does a healthy sleep cycle looks like? And especially for young girls like all of us right here.
Healthy sleep cycle is that you are getting a sleep that is the duration should be appropriate for your body, and the duration it is different for every individual. Some people they might need only 6 hours of sleep, some may need even 10 hours of sleep. You should not feel rushed, you should not feel any kind of fatigue or drowsiness. So if it is not happening, then it means you had a good quality of sleep. And sleep disorders हम कब label करते हैं? If there is a problem in onset of sleep, that is basically insomnia. If it is there is a sleep latency period, अगर 15 to 20 minutes के बीच में आपको sleep नहीं आ रही है, it is taking longer than that duration, then it means that it is a sleep disorder. And at night there should not be many awakenings. Frequent awakenings should not be there. And in the morning you should be able to wake up on that particular time when the duration of sleep completes. So it should not be earlier than that.
Wow. Thank you so much, ma'am.
As हम talk about the sleep disorders, I want to ask कि जैसे कि आपने बताया कि बीच बीच में कम वो होना चाहिए sleep disturbance. So क्या ये मतलब अगर जैसे कि कभी कभार हो जाता है, ये मेरे साथ कभी कभार हो जाता है कि फ्रीक्वेंटली आई फील लाइक कि अब सुबह हो गई है एंड आई हैव टू वेक अप, बट लेकिन वो उस टाइम पे बज या तो 2 बज रहे होते हैं या 3 बज रहे होते हैं एंड इट्स केम अप विद द फ्रीक्वेंट, बट ये कभी कभार ही होता है लाइक वीक में एक बार या 2 बार. सो इट काइंड ऑफ अ नॉर्मल थिंग या फिर कुछ आई हैव समथिंग थिंकिंग कि मैं कुछ सोच के सोई हूं तो तब ये होता है.
स्लीप डिसऑर्डर हम तब लेबल करते हैं if these kind of problems they are there for more than 3 days in a week. So if it is happening once in a while, like once or twice a week, then it is normal. Because just like you mentioned that you were worried about something and then you went to bed, then you will be having those thoughts in your subconscious mind, and you will be in an alert position when you are going to sleep. So you are sleeping with anxiety actually, and your brain needs to be relaxed for your sleep. So basically, it is those thoughts that are causing trouble in your sleep. And once in a while, it is normal.
ओके. एंड इफ समवन हैविंग द स्लीपिंग लाइक कि वो रात को तो अच्छे से सोई है बट वो जैसे कि सुबह उठी है तो भी थोड़ी स्लीपनेसनेस है एंड थोड़ी मतलब वो जब भी सोती है वो मतलब ऐसा नहीं है कि उसका पर्टिकुलरली उसको रात को ही नींद
हम्म
आएगी, बट अगर वो दोपहर को भी लेट गई या फिर 12 1 बजे भी लेट गई तो बहुत जल्दी
हम्म
सो जाती है. एंड मतलब हर टाइम उसे जैसे ही बोलो ना कि मतलब कोई काम नहीं है कि चलो सो जाते हैं
हम्म
तो वो इंस्टेंटली सो जाएगी. एक मतलब होता है ना कि आपको हाफ एन आवर या फिर नींद आती है तब आपको सोना चाहिए, बट ऐसा कुछ पैटर्न नहीं है कि
हम्म
हाँ कि ऐसा कुछ हो तो बट इट्स कॉल्ड लाइक.
इसका मतलब ये है कि that person is having an irregular sleep schedule. ठीक है. There is a thing called sleep hygiene. अगर आपको अपनी स्लीप अच्छी रखनी है तो यू हैव टू मेंटेन अ पर्टिकुलर schedule, like this at this point of time you are going to bed, and is at that certain period of time, after a certain period of time you are going to wake up, and after that you are not going to go to bed. You know, so if she is sleeping during daytime, it means she is not following sleep hygiene. Sleep is never recommended during daytime. You can take a nap for 15 20 minutes or half an hour, or you can rest, but you don't need to sleep for 1 or 2 hours in the daytime. Sleep is basically for your night. If you are not making keeping that schedule at night time, then it is going to cause disturbances.
तो ओके, सो आई हैव सीन दिस केस कि मतलब वो रात को भी अच्छे से सो रही है, ऐसा कुछ नहीं है कि वो बीच में उठ रही हो या इरेगुलर हो, वो अपने टाइम पे ही सो रही है एंड शी इज हैविंग मोर देन 6 आवर्स ऑफ स्लीप. बट
हम्म
लेकिन उसके साथ प्रॉब्लम ये है कि वो जैसे मैंने आपको बताया वो कभी भी सो जाती है, ऐसा कुछ नहीं है कि उसको रात को ही सोना है. एंड अगर वो दोपहर को सो गई सो इट्स डिफिकल्ट टू वेक अप, तो मतलब कि उसको बोलते रह जाओ कि उठ जाओ
वही
एंड शी
मैंने
इज
आपको
लाइक
बताया ना
आई.
कि जो क्योंकि जो रात की नींद है वो दिन में ही पूरी कर लेती है.
ओके,
ठीक है ना.
सो रात को भी नींद आ सकती है फिर.
आ सकती है, बट वही है ना कि उसका ड्यूरेशन कम हो गया. ठीक है
ओके.
ना. तो जो स्लीप प्रेशर जब हम दिन में जागते हैं तो हमारा एक स्लीप प्रेशर बनता है जो हमें रात को सोने में हेल्प करता है। लेकिन अगर हम दिन में ही सो जाएंगे तो हमने उस प्रेशर को रिलीज कर दिया, और रात को हमें जितनी चाहिए है स्लीप उतनी हमें नहीं मिल पा रही है, इसलिए फिर हमें दिन में नींद आएगी। That is why we recommend that don't sleep in daytime even if you are feeling sleepy. You need to develop that sleep pressure for a good night's sleep.
सो इसमें फिर हमें चेंज करने में फर्स्ट ऑफ ऑल क्या चीजें मेजरली हमें चेंज करनी चाहिए? मतलब नींद तो आ रही है, वो एक रूटीन बन गया तो वो हर टाइम होगा ही होगा, तो उसको चेंज करने के लिए कि हमें क्या करना चाहिए?
इसमें तो बेसिकली इट इज गोइंग टू टेक टाइम टू चेंज।
हम्म।
सो विद प्रैक्टिस उनको अपना स्लीप स्केड्यूल चेंज करना पड़ेगा। तो रात की स्लीप को इम्पोर्टेंस दें और दिन की स्लीप जितना ज्यादा हो सके उसको अवॉइड करें। अगर अभी 2-3 घंटे सो रही हैं तो उसका धीरे धीरे करके ड्यूरेशन कम करते जाएं, है ना। और कोशिश करें कि दिन में ज्यादा ना सोएं, और रात का जो है एक प्रॉपर टाइम और मॉर्निंग का एक प्रॉपर टाइम बना के सोएं। बेसिकली डिसिप्लिन करना है अपने आप को।
गॉट इट, थैंक यू सो मच। या गो अहेड।
Uh, so, ma'am, I have one question. So, there's this person. She's one of my friends. तो रात में उसको क्या होता है कि जब रात होती है या सोने का टाइम होता है उसके थोड़ा सा पहले, जब डार्क हो जाता है, तब शी फील्स लाइक extremely she gets extremely scared, and उसको ये लगता है कि अगर मैं सोई तो I don't want to die, and that's something जो she faces a lot, like every single night या फिर every second night she suffers from it, like कि कुछ हो ना जाए, एंड ये सिर्फ रात को होता है, दिन भर बिल्कुल नहीं होता। तो लाइक आर देयर एनी कमेंट्स?
तो हो सकता है उसके कोई पास्ट एक्सपीरियंसेस ऐसे रहे हो जिसमें ऐसा कुछ हुआ हो, या उसने कुछ विटनेस किया हो या कुछ सुना हो ऐसा। तो वो फिर जब वो क्यू मिलता है कि रात होने वाली है एंड सोने का टाइम आने लगा है तो वो ट्रिगर हो जाता है। सो इट कैन लीड टू सोमनीफोबिया ऑल्सो, कि शी इज हैविंग फोबिया ऑफ स्लीप। ठीक है, तो हो सकता है कि कोई अंडरलाइंग एंजाइटी प्रॉब्लम उसको हो, एंड अंडरलाइंग कोई कॉन्फ्लिक्ट्स हैं जो रिजॉल्व नहीं हुए हैं। दैट इज व्हाई शी इज गेटिंग fear ऑफ स्लीप।
So ma'am, is there anything like I can tell her to do that will help her?
सबसे पहले तो थोड़ा डिटेल में पूछना पड़ेगा एनी कि जब वो थॉट्स आते हैं तो इज इट रिलेटेड टू समथिंग एल्स, कि कुछ पास्ट में ऐसा हुआ हो, कुछ सुना हो, कोई चाइल्डहुड एक्सपीरियंस हुआ हो जिसमें उसने ऐसा फील किया हो, है ना। तो पहले तो उन्हीं चीजों को एड्रेस करना पड़ेगा।
And like a lot of
एंड
her, I'm so sorry, but a lot of her family members, like उसके नाना जी जो उससे बहुत क्लोज थे, and उसके मौसा जी, they passed away like this only, like, तो उस चीज का ट्रॉमा।
हाँ, सो वो तो फिर थेरेपी से ही रिजॉल्व होगा ना। तो उसमें बेसिकली उस एंजाइटी को ठीक करना है।
थैंक यू।
Hello, ma'am. I actually wanted to ask that since you have got two national papers published, and next time I'll be having my dissertation. So I wanted to know more of how a person, what factors a person should consider when they're conducting a research, and what considerations one should be taking care of if they are looking to get that research published.
कैन यू एक्सप्लेन मोर?
Like if I am doing it just for my dissertation, but I do want to get that research published. So what should I do exactly in that direction? And what should I consider when I'm doing a research in general so that it is very
So
informative?
for publication, basically dissertation, it is a very lengthy form of a paper. So you just need to summarize your dissertation in the paper, and in paper there are some categories, like you first have to write the abstract, then the introduction part. It is basically same as the dissertation, but it needs to be in a shorter form. Okay, and for publication, you need to see what kind of journal you want to get it published. For that journal, you need to see what is the impact factor of that journal, like how many people are using it, reading it, and citing it for other studies. And the second thing is whether that journal it is indexed or not, because there are many fake journals also available. So you need to check whether it's indexed. Indexed mean that it is available in the particular sites, like PubMed is there, Scopus is there. So it should be indexed in that. That is how they decide that that journal is authentic or not.
Okay, ma'am. Thank you.
So, ma'am, I have a question regarding the sleeping pattern. So, like, जैसे हम college going students हैं, तो what I feel sometimes कि suppose I have an event tomorrow या मुझे मतलब कुछ करना है. For example, like कोई fest है, तो उसका I was a coordinator that time. So what happened with me, if I'm sleeping at night, मैं proper time scheduling पे सो रही हूँ, but that thing कि ओ सुबह मुझे उठ के ये करना है, ये करना है, ये करना है, while sleeping those things were going in my mind, and when I woke up तो वो चीजें भी मेरे दिमाग में थी. तो what is that called, and like उसका क्या क्या मतलब क्या reasons है उसके, या मतलब क्या चीज है वो एक्चुअल में.
It is not called anything वैसे तो. इट्स बेसिकली कि आप स्ट्रेस लेके सोए हो रात को.
Yeah.
ठीक है ना. और स्लीप के लिए बहुत ज्यादा इम्पोर्टेंट है कि आपका माइंड जो है वो रिलैक्स्ड होना चाहिए. बिकॉज जब हम स्ट्रेस लेते हैं तो हमारा ऑटोनॉमिक नर्वस सिस्टम एक्टिवेट हो जाता है, और एड्रेनलिन, नॉरएपिनेफ्रिन, ऐसे केमिकल्स रिलीज होते हैं जो हमें अलर्ट कर देते हैं.
जी.
ठीक है. तो अब आप सोए हो और आपका दिमाग पर अलर्ट है, तो उसमें तो थॉट्स चली जा रहे हैं, एंड जो ब्रेन का पार्ट जो स्लीप के लिए इम्पोर्टेंट है वो ठीक से काम नहीं कर पा रहा है. सो इस सिचुएशन में आप ऐसा कर सकते हैं कि सोने से पहले जो भी आपके माइंड में थॉट्स आ रहे हैं, किसी भी चीज का आपका स्ट्रेस है या कुछ है, तो उसको आप एक कॉपी में या डायरी में लिख लें. ठीक है ना. कि मेरी क्या क्या प्रॉब्लम्स है या मुझे कल क्या क्या करना है, और उन प्रॉब्लम्स का क्या क्या सॉल्यूशन है. उनको जब आप लिख लेते हैं तो आपका माइंड जो है वो रिलैक्स हो जाता है, और आपके पास एक प्रॉपर सॉल्यूशन होता है कि हाँ अब मुझे वरी करने की बात नहीं है. ठीक है ना.
Okay.
सो दिस इज कॉल्ड कंस्ट्रक्टिव वरी टेक्निक. कि आप अपना जो वरीज हैं उनको एक जगह पे आपने लिख दिया, उनका सॉल्यूशन भी लिख दिया, तो आपका माइंड रिलैक्स हो जाएगा, एंड आपको स्लीप प्रॉपर आ जाएगी.
जी. एंड मैम जैसे कभी कभी तो आपने जैसे बोला क्वेश्चंस के सॉल्यूशंस लिखो, बट सम टाइम इट हैपेंस कि अगर मुझे कॉलेज पहुंचना है सपोज 9:30, तो मतलब मेरा पूरा शेड्यूलिंग रेडी है कि अच्छा मुझे 8 बजे उठना है, देन आई हैव टू टेक अ बाथ, फिर ब्रेकफास्ट, ये वो. तो मेरे दिमाग में वो भी कभी कभी घूमता रहेगा कि अब मुझे 8 बजे उठना है. अब मतलब वो प्रेशर रहता है एक चीज. तो लाइक हाउ टू
हाँ.
डील विद दैट पर्टिकुलर थिंग, क्योंकि समटाइम्स और द अदर डिस्ट्रैक्ट्स मी और डिस्टर्ब्स मी अ लॉट, ये वाली चीज हो जाती है.
तो उसके लिए फिर आप रात को सोने से पहले कुछ ब्रीदिंग एक्सरसाइजेस कर सकते हैं, ताकि जो अलर्टनेस लेवल है वो थोड़ा सा कम हो जाए.
जी.
एंड या फिर आप रिलैक्सेशन एक्सरसाइजेस होती है, जैसे JPMR होती है. ठीक
हम्म.
है. वो आप परफॉर्म कर सकते हैं. उससे भी आपका जो बॉडी में जितनी टेंशन होती है वो सारी रिलीज हो जाती है, एंड आप रिलैक्स्ड वे में आप सो पाते हैं रात को.
जी मैम.
बाकी तो यही है कि आप जो थॉट्स हैं उनको फिर कंट्रोल करने के लिए आपको थोड़ा सा वर्क करना पड़ेगा. उसके लिए
हम्म.
आपको जर्नलिंग वगैरह स्टार्ट करनी चाहिए, कि व्हाई आर दीज थॉट्स कमिंग एंड व्हाट कैन बी डन अबाउट दैट, कि इसकी जगह मैं क्या सोच सकती हूँ. बिकॉज अगर इतने सारे थॉट्स लेके आप बेड पे जाएंगे तो स्लीप में डेफिनेटली प्रॉब्लम आएगी.
या मैम. एंड मैम वन मोर थिंग, लाइक समटाइम्स लाइक जैसे हम लोग कॉलेज स्टूडेंट्स हैं, तो नॉट ओनली विद मी, लाइक माय फ्रेंड्स एंड मतलब जितने भी लोगों को मैं जानती हूँ ऑलमोस्ट. तो व्हाट हैपेंस जैसे कि वीकेंड्स है, तो लाइक इफ वी आर नॉट स्लीपिंग प्रॉपरली, लाइक अगर हम 6-7 घंटे भी सो जाए, तो वो वीकेंड का सोच के ही लाइक वी आर लाइंग ऑन द बेड द होल डे। मतलब वो वाली चीज है कि हमें मतलब पूरे दिन ही आती है। तो लाइक इट इज अ पर्टिकुलर थॉट पैटर्न दैट आई एम कंसिडरिंग कि हाँ वीकेंड है तो हम पे मतलब हमें मतलब इतना कुछ रिलैक्स है, कॉलेज नहीं है, कुछ मतलब जल्दीबाजी नहीं है किसी काम की। तो लाइक इज इट अ पर्टिकुलर थॉट पैटर्न या मतलब क्या चीज है ये? क्योंकि नॉट ओनली इन मी, आई हैव सीन इन मेनी ऑफ माई फ्रेंड्स टू।
ये तो नॉर्मली होता है जब आप वीकेंड आता है या आप वेकेशन पे जाते हैं या जब आप फ्री होते हैं, देन यू टेंड टू रिलैक्स योरसेल्फ, है ना। इट्स क्वाइट नॉर्मल, आई थिंक एवरीबॉडी डज इट।
हाँ बट मैम वो चीज ऐसे होती है कि सपोज आई हैव टेकन लाइक 8 hours ऑफ स्लीप एट नाइट, बट
हम्म।
सुबह भी वो नींद पूरी ही नहीं हो रही है मतलब जाके।
इसका मतलब आप रात को लेट सोए हो।
जैसे सपोज मैक्स टू मैक्सिमम मैं 12 बजे तक तो सो जाती हूँ, उसके बाद तो नहीं उठती मैं। क्योंकि
रूटीन में।
नहीं नहीं, रूटीन में नहीं, रूटीन में तो थोड़ा जल्दी सोती हूँ जल्दी उठती हूँ, ये
हम्म।
वाला चीज तो
हम्म।
फिक्स्ड है। मतलब जैसे वीकेंड्स वगैरह पे बोल रही हूँ, सपोज इफ आई एम स्लीपिंग एट 12 एंड आई एम वेकिंग अप इट इन द मॉर्निंग लाइक
हम्म।
7 8 समथिंग लाइक दैट,
हम्म।
तो उसके बाद भी लाइक दिन में आई कैन स्लीप फॉर 5 6 hours कंटिन्यूअस। तो मतलब ये वाली चीज।
तो फिर उसके बाद फिर नेक्स्ट डे स्लीप में प्रॉब्लम आती है।
नहीं मैम, वही तो मैं कह रही हूँ, जैसे 3 दिन लाइक मतलब कंटिन्यूअस ही चीज है।
हम्म। ये तो रिलैक्सेशन ही होता है, इट्स नथिंग सीरियस, ये
ओके,
ऐसा कुछ नहीं है।
दैट्स ऑल फ्रॉम
एंड इट
माय।
हैपेंस विद एवरीबॉडी। बेसिकली आप रिलैक्स्ड होते हो, आप कई बार होता है कि आपके पास कुछ करने को नहीं होता है, तो आप बेड पे लेट जाते हैं एंड आपके रूम का एनवायरनमेंट ऐसा होता है कि आप बहुत ही कंफर्टेबल फील करते हो। देन यू, या फिर आप बोर हो रहे हो, देन ऑल्सो यू गो टू बेड, यू कैन स्लीप। ठीक है, तो इट्स क्वाइट नॉर्मल।
या मैम वीकेंड्स पे तो लाइक आई मेक द एनवायरनमेंट दैट मच कंफर्टेबल कि मैं सोती रहूं, थोड़ा चिल ही रहूं।
इट हैपेंस विद एवरीवन।
ओके।
Anyone has any question?
Yes, I have one question. Hello, ma'am. So, ma'am, my question is that like there is, अब जैसे रिताशा ने बोला था कि ADHD बहुत बढ़ रहा है बच्चों में, राइट? एंड लाइक मेरे को खुद भी ADHD है, so this is something that this area really interests me. Ma'am, what do you think about medications for ADHD? Because again, it is a neurodevelopmental disorder, and if it is hampering a person's life, then you do need medication. जैसे कंसर्टा या रिटेलन हो गया, बट लाइक व्हाट डू यू थिंक कि मेडिकेशन का ज़्यादा रोल है या फिर थेरेपी का ज़्यादा रोल है अल्टीमेटली लॉन्ग टर्म? क्योंकि मेडिकेशंस के भी बहुत जैसे साइड इफ़ेक्ट्स होते हैं, लाइक भूख नहीं लगती एंड बच्चों में लॉन्ग टर्म ग्रोथ भी डिसरप्ट हो जाती है। सो व्हाट इज़ योर ओपिनियन ऑन
That
दैट?
basically see depends on the severity of the condition. वही ना, अगर तो माइल्ड है तो सिर्फ थेरेपी से इट कैन बी कंट्रोल, बट अगर उसकी सेवेरिटी ज्यादा है देन ओनली थेरेपी इज नॉट गोइंग टू हेल्प। एंड medicines, they are basically life changers in case of ADHD. साइड इफेक्ट्स आर देयर, बट साइड इफेक्ट तो पैरासिटामोल के भी होते हैं, बट वो लेने से पहले हम सोचते नहीं है ना। तो साइड इफेक्ट्स आर देयर एंड हम पेरेंट्स को ये प्रिकॉशंस और एडवाइस दे के चलते हैं कि कुछ भी अगर ऐसा होता है, बिकॉज हमें पता है कि इसका ये इफेक्ट है, तो रेगुलरली वी मेजर द हाइट एंड वेट ऑफ द चाइल्ड की उसकी डेवलपमेंट कैसी हो रही है। एंड आफ्टर अ सर्टेन पीरियड ऑफ टाइम, जब एक लेवल बन जाता है मेडिसिन का इन योर बॉडी and the patient is well for most period of time, then we can कि उन साइड इफेक्ट्स का हम ये सॉल्यूशन निकाल सकते हैं that we can give drug holidays to the patient। ठीक है, कि जैसे अगर स्कूल गोइंग है तो वीकेंड्स पे मत लो मेडिसिन, है ना। स्कूल में जाना है तो कंसंट्रेशन की तो बहुत जरूरत है, तो उन दिनों में लो मेडिसिन, हॉलीडेज के टाइम पे, वेकेशन हुई है तब you can stop medicine or you can decrease the frequency of taking the medicine. So in that way we can adjust that thing. And supplements are also there that we can give to the child. Plus not every child is going to have these side effects। ठीक है, अगर 10 में से 2 को हो रहे हैं तो हम 8 को भी मना थोड़ा ना कर सकते हैं कि नहीं, इनको भी नहीं देनी है। है ना। तो साइड इफेक्ट्स हर मेडिसिन के होते हैं एंड उनका सॉल्यूशन भी अवेलेबल है। एंड जो ट्रीटमेंट है वो एज के ऊपर भी डिपेंड करता है, सिवियरिटी के ऊपर भी डिपेंड करता है, फंक्शनिंग के ऊपर डिपेंड करता है। बट मेडिसिन आई वुड से दीज आर लाइफ।
Any
Yeah,
other?
I had a question. Hello, ma'am. It was really nice. This session was very insightful. So I wanted to add on to something Taranpreet said. So Taranpreet had asked, as a psychologist or as a psychiatrist for new mothers or pregnant women, what can be done. But if we don't see from a professional point of view, if we just see as a family point of view, if I have a family and if someone's pregnant or has given birth, what is there to we could do something to prevent them from getting to that stage? As you said, it is differs from person to person and the kind of environment there. So as family, what is something we can do that we can help them or prevent them from getting to such a state?
फैमिली का तो देखिए सबसे इम्पोर्टेंट रोल है कि आपको सपोर्ट करना है फीमेल को, है ना। वट एवर काइंड ऑफ प्रॉब्लम्स शी आर हैविंग, हैव टू एड्रेस देम, बिकॉज ड्यूरिंग प्रेगनेंसी और आफ्टर डिलीवरी ऑल्सो एक स्लीप एक बहुत बड़ा इशू हो जाता है। ठीक है, तो ड्यूरिंग प्रेगनेंसी तो चलो हम स्लीप के लिए वी कैन गिव मेडिसिन, बट आफ्टर डिलीवरी स्लीप ना आने का एक मेन रीजन होता है कि द बेबी वेक्स अप वेरी फ्रीक्वेंटली एंड द मदर हैज टू फीड हिम और हर। So in that case, family has a very big role, that husband or in-laws, they can take turns and they can then feed the baby. Like if she's breastfeeding, you can collect milk in the bottle for the night time, and some other person can feed the baby, and the mother can take appropriate time of rest. So for that, and plus जो एक बहुत ही कॉमन होता है कि कुछ भी बोल देते हैं लोग फीमेल को प्रेगनेंसी के दौरान या डिलीवरी के बाद। सो उस चीज का बहुत लोगों को ध्यान रखना चाहिए कि कुछ भी नहीं बोल देना चाहिए, बिकॉज वो ऐसा टाइम होता है कि जो इमोशनल वेलबींग है वो भी उस टाइम पे एक डिफिकल्ट पीरियड से गुजर रही होती है एंड एवरीथिंग हर्ट्स एट दैट टाइम। So अपना sense of what you are talking, how you are behaving, family members have to change that also, and they should address every kind of problem that the women is having.
Thank you so much, ma'am.
Okay, so thank you so much, ma'am. It was a really nice interview, and we have gathered a lot of information, new informations. So thank you so much, ma'am, for today's interview.
Thank you for having me.
Thank you so much, ma'am.